प्रोफाइल का लोगो एडजस्ट लेट करना कट रहा है।
अभी कर दो, टाइम है।
अभी इस
Good afternoon, everyone. We'll wait for 5 more minutes as we are expecting few more participants to join, and then we can start with today's session. Good afternoon, everyone. A very warm welcome to all of you for joining us today. I see that uh, more people are expected to join as and when this webinar progresses. So, in the meanwhile, we can start with an introduction. I am Aryaman, and I'm delighted to open today's webinar hosted by Kalam Institute of Health Technology in collaboration with ISPOR India ISF College of Pharmacy Student Chapter. Kalam Institute of Health Technology aims to facilitate focused research on critical components pertaining to medical devices by supporting institutions involved with R&D, industry, policymakers, and knowledge repositories. This shall be achieved through transfer of technical knowledge and bringing strategic and coherent synergy of scientific facilities and institutions to complement efforts on industrial promotion in the medical device segment. It lives to bring increased access to affordable health products to citizens and thriving medical devices manufacturing in India. So, we have with us the Chief Operating Officer of Kalam Institute of Health Technology, Dr. Kavita Kachru, who will be giving a brief overview of the entire ecosystem that we have in Kalam Institute of Health Technology, which is hosted in Andhra Pradesh MedTech Zone, Vishakhapatnam. Over to you, Dr. Kavita.
Thank you so much, Ariman, and a very warm welcome, everyone. So let me share my screen. Is my screen visible? Can you see my screen, Ariman? Is it visible?
Yes,
And
ma'am.
am I audible?
Your screen is visible, yes.
Okay, so very warm welcome again. As you all know that we are hosting this webinar series in partnership with ISPOR, and today is our sixth webinar in this series. So let me just start with a brief overview, as we do that as a tradition when we start this webinar. So, as you all know, that Kalam Institute of Health Technology has been set up in the name and honor of our beloved President, Dr. APJ Abdul Kalam, and is one of its kind globally. Kalam Institute is a Government of India project supported by Department of Biotechnology and is also a WHO collaborating center for health innovations. It also draws its credibility from the fact that Kalam Institute is housed in AMTZ, which is Asia's largest medical device manufacturing cluster. As Dr. Kalam once said, innovation distinguishes between a leader and a follower. With this in mind, KIST is leading the charge to transform healthcare innovation globally. Now, uh, let me show you the departments which are under Kalam Institute of Health Technology. As you all can see, we work with Government of India, and we also have international collaborations. We have department and pillar like CHTA, which is Center for Health Technology Assessment, CMIT, CRO, KCS, IVD testing, IJHT, KBC, and PMRU. I will explain you in another slide. So, coming back to the explanation of all these departments, we have Center for Health Technology Assessment. We are a DHR resource hub, and we do a lot of health technology assessment, report back to the government, and then it goes to the national procurement system. That's how we are aiming for. With this, we are trying to evaluate innovations and health technologies programs which are clinically effective and cost effective, which can bring a on ground change with lots of savings to the government. Right, so that's all we do under this HTA. We're also a DHR resource hub for that. Under CMIT, which is Center for Market Intelligence and Trade, we do a lot of trade analysis, export and import data analysis. As you all know that we are still are so much import dependent on when it comes to medical devices and health sector. So we try to understand the global scenario of trade and this trade deficit, and we try to come up with a booklet known as Globe Exam, so Global Export and Import Data findings. That booklet is very important. Whosoever wants to know which are those areas where we know we're still importing and we need to enhance our internal capacity, then you should, any industry manufacturer or innovator who wants to crack that deal where India is still importing and we need to enhance our indigenous capacity. So you should refer Globism. It is available on our website. You can order online. Then, as you all know, clinical research organizations, CROs, are very important when it comes to generate evidence on innovations, medical devices, or any intervention. So we have that separate department as well. We do trials and we generate evidence on innovations. Coming to price monitoring and resource unit. So this unit is under National Pharmaceutical Pricing Authority, and we do primary research. We go to the market. As you all know, that Government of India has a price capped some essential drugs. So we go to the market and you see, evaluate whether these price capped drugs are are breaching the mark which is set by Government of India or not. So as of now, we have captured more than 300 samples which were violating the norms, and the price was capped again. We also found very strange thing. It's like some samples were even 100% higher than the price capped level. So we have contributed immensely to bring those essential medicines back to the price capping, which has led to immense out-of-pocket expenditure for the Andhra Pradesh, citizens of AP. We also have a blood center, Kalam Blood Center, in our in our zone, and it is also one of the pillars. We have International Journal of Health Technology and Innovation. If anyone of you is interested in publication, your studies are more than welcome. We will evaluate it. We have a very stringent board, editorial board, who reviews the papers, articles, and then we publish them, because publication again is a very important part in the entire curriculum, because publishing is with international journals sometimes take so much time, and sometimes good papers get rejected as well. So we have an in-house journal for that. Again, during COVID, we established a center known as IVD Testing Center, because we already had testing kits, but there was not any testing center. So we generated, or we innovated, or brought in our IVD testing kit center. With all these things, we also have to have a certification center. So we have KCS, which certifies different bodies to conduct assignments and other programs. So we have a auditing body as well under KIST. As I had already told you, we have some international collaborations as well. And I already mentioned that Kalam Institute of Health Technology is a WHO collaborating center. So with this, we give guidance and we closely work with Innovation Hub headquartered in Geneva. And we try to give scaling, we try to give guidance, and we try to immensely contribute to the guidelines which WHO brings forward to. Then we are also a JBI affiliated group. With JBI, we do lots of systematic reviews and evidence implementation reports. If you want to work on any systematic review, or if you need any guidance on evidence implementation, if you want to join hands with us, you're more than welcome. Just let us know what is the topic which is in your mind. We can help you in facilitating evidence implementation reports, systematic reviews, scoping reviews, or any other thing which you need guidance on. Since we are partnering with ISPOR, and the series is also a part of that partnership, we are trying to build the capacity in the country. We are also trying to generate awareness on different very important subjects. As today's topic is very much relevant for HTA, evidence generation, publication, quality, quality evidence work, or or even to understand the systematic review process. So today's webinar is very, very important. And that's how with ISPOR, we are working closely for this webinar series. We are working with ISPOR We are updating the PE guidelines. We are also writing a white paper on Indian scenario on health economics and outcomes research. If any of you is interested in working with us, please let us know. We will definitely consider that. Kalam Institute is also partner to START Center, which is under the University of Washington. We closely do projects with them as well. Then, since as I already mentioned that we are health technology assess, we do health technology assessment, so we are related to and we are partners to HTAI as well. And coming to IAPB, that is International Association for Prevention of Blindness, since we are a manufacturing zone and we also manufacture assistive technologies, and this IAPB is uh, biggest collaborative agency on which is contributing to blindness control. So we try to be partner and we also give our guidance. We play a major role with them as well. Then you can see some glimpse of ISPOR and KIHT activities. ISPOR with KIHT, we are leading all other Indian chapters in updating pharmacoeconomic guidelines, which I mentioned, and webinars. We are trying to build capacity. This is one of the kind of that webinar. And also, I would like to invite you all to participate in World Health Innovation Forum, which would be happening in the month of December. You can see the list of webinars we already have hosted and we would be hosting, and this is the sixth one. Very interestingly, we also host the International Fellowship on Health Technology Assessment. It is one of its kind fellowship, and we have the faculty from University of Washington, University of Toronto, and University of Arizona. So we would be hosting 11th fellowship from 10th to 15th March. If anyone is interested, please let us know. We will enroll you for this upcoming batch. Glimpse of Globexim report, as I already mentioned you during our CMIT work, we are also a technology policy secretary to the 12 different ministries of government of India. And if you're interested, you can just have a look on this report, which is there on our website. This glimpse of the International Journal of Health Technology and Innovation, I already mentioned you. And this is the World Health Innovation Forum. This year we would be hosting. It's from 11th to 13th December 2025. If any one of you is interested to participate, to even submit abstract or shows any of your innovation, you are more than welcome to join us during World Health Innovation Forum in the month of December. So with this, I would like to stop here as today's topic is very, very important and it is very much relevant for all the researchers who are here today with us. So over to you, Aryaman. Thank you, everyone.
Thank you so much, ma'am. At KIHT, we constantly are working to build stronger capacities in evidence based research, health technology assessment, and policy relevant analytics. Today's session is a step in that direction. So, the topic for our webinar is both timely and essential: the importance of effective literature retrieval for evidence synthesis. In an era where vast amounts of scientific data are produced daily, the ability to identify, retrieve, and synthesize relevant literature is not just a research skill, it is a cornerstone of credible decision making in healthcare. To help us explore this subject in depth, we are honored to have with us Dr. Krishna Undela, Assistant Professor in the Department of Pharmacy Practice at Naipur, Guwahati. Dr. Undela brings with him extensive expertise in systematic reviews, clinical pharmacy, and academic research methodology. His guidance today will be incredibly valuable, especially for students and early career researchers and professionals striving to make their work impactful. Before we begin, a quick note for all our audience. Please keep your microphone on mute during the session. If you have any questions, feel free to drop them in the chat box. We will take them up during the question and answer session at the end. With that, I now invite Dr. Krishna to take us through today's session. Over to you, sir.
Thank you, Ariman, for that kind introduction. And I'm very happy to see this webinar series organizing by ISF ISPA student chapter in association with KHIT, Kala Ministry of Health Technology. So it's very important, I think, the webinars what you are arranging on this very important topics. And today, I think we are going to see one more domain, I think, among all the webinars listed out there. I felt that I think for all the students, all the students attending and researchers attending this one. So the topic is given. It's a very important one for all of you. And as Ariman, every day we are getting so much of literature. Can you please unmute the people?
Yes, I request people to mute themselves while listening.
Yeah, thank you. So as Ariman mentioned in his introduction that no, every day now we are getting so much of literature into the scientific domains, right? Everyone is conducting the research and they're publishing the information. So we're getting so much of information, and it's very important for us to understand, being a pharmacist, being a healthcare professional, it's very important for us to track down the very important information, which will be helping us for taking any healthcare decision, right? So in that process, understanding the literature search, especially the advanced literature search, especially in PubMed and other databases, what we're using commonly, is very important. And also, as Dr. Kavita mentioned from KHT, while conducting any systematic reviews, meta-analysis, or during the process of evidence synthesis, one of the important steps is going to be like literature search. How you're searching is depending upon, is entirely depends the quality of outcome what we're going to generate from the systematic reviews and meta-analysis, and also from evidence synthesis. So if you do a good search in the different databases by having a proper search strategy, you're going to get a very good literature on the topic what you have selected, and the outcome what you're going to get out of this systematic review meta-analysis is going to be like much trustworthy, and we can believe the findings. And if you're not doing a proper search, because the systematic review, the main reason why we are keeping systematic, the meaning is like whatever the review what we're performing, we are doing in a systematic way. We are starting the systematic way with the literature search. We are doing a literature search in a systematic way, in the sense like we are not depending upon only one database. We are going through multiple databases which are available with us, PubMed, Embase, Google Scholar, Scopus, whatever available with us, we can go and search all the databases. First thing, very important thing. And when you're going through these databases, when you're searching for literature, it is not that simply we are going and searching in PubMed by using the search box. We need to have a much more understanding about how to search in PubMed and how to search in other databases by incorporating the different search strategies. So that's what we're going to discuss today. What are the search strategies we are going to perform while searching for literature? And especially because we have a very limited time, I can explain to you mainly the PubMed search, because that's what is important. That's what we are going to include in all the systematic reviews, the minimum thing. If you know how to search in PubMed, I'm sure that you can able to search in any other database very easily. And especially searching PubMed by using few important aspects, which we are going to discuss today. I think without any further delay, maybe we can go through the slides and then see what is the content available here. And also I can demonstrate to you at the end how to search in PubMed by taking one example, so that it will be very clear for you. You can also understand how we need to search in PubMed. Ariman, can we have a next slide?
Yes, sir. Just a minute.
The literature search, the meaning, if you can see what exactly we are going to do it here, it is a systematic and well-organized search from already published data to identify the breadth of good quality references on a specific topic. So whenever we are doing any systematic review, as we know that we are going to have a topic with us, we are going to have a hypothesis with us, the review topic. On the topic, we need to go and search for the literature. And it is not that we are doing any new research here. We are collecting the information already existing in the published literature. That's what we are doing here. But whatever we are doing here, we are doing in a systematic way. That's what is very, very important to understand. Whatever search you are performing, if you're simply performing, you're not going to get the proper results. You're not going to identify the very important articles. If you do the search in a systematic way, well-organized search when you perform, you're going to get the most appropriate articles for your research question. Okay, that's what we are going to do. And when you're performing such strategy, you can see here what are the things we need to consider. Like, first of all, we need to identify the key concept and terms. Understanding the keywords is very, very important, first of all. And for that reason, we are going to have something called a PICO format. PICO format, which we are going to use commonly for searching any database, and where the P stands for population or patients, and I stands for intervention, C is comparison, and O is outcome. In any review question, what you're going to take up, the entire review equation we can convert into few important keywords based on these 4 important parameters. What are the keywords we are having for the population, the keywords we are having for the intervention, keywords we are having for the control, and the keywords we are having for the outcome. So enough. So because whenever you have a research question, the hypothesis, which is coming maybe around 3 to 4 lines, the entire 3 to 4 lines of hypothesis we cannot keep in a search box, and we cannot search. If you do also, we are not going to get proper results. So what we need to do is, like, from the entire hypothesis what you're having, the research question you are having, we need to identify some of the important keywords from that research question, and those keywords we are using for the searching literature. Okay, so that's the first thing we need to do, identifying the proper keywords for any topic what we have selected, and then select the relevant databases and then resources. Very important, we should not depend upon only Google Scholar or maybe only one database. At least we need to have minimum 3 to 4 important databases when you are conducting in a proper systematic review. And now, as per the ICMR policies, minimum databases what we need to include, like PubMed, Embase, and Cochrane Central, as well as Scopus. So these are the 4 minimum important databases we need to follow while conducting any systematic reviews, especially when you're going for the development of any guidelines. So we need to follow those databases for searching literature. And then we are going to combine the search terms by using Boolean operators. Boolean operators are very, very important while searching literature, especially the advanced search when we perform in the PubMed. Understanding Boolean operators, where to keep, when to keep is very important. I'll show you that, how exactly we are going to use the Boolean operators like and, or, not. So these are the 3 important Boolean operators we're going to use it while searching PubMed or any other databases. And we are going to keep them mainly in a capital letters. So keeping the Boolean operators in caps is very important while searching databases, and, or, not. Okay. And then run searches in selected resources. We're going to run the strategy and review and refine the search results. Like, once you get the results, based on that, you can identify that, are you getting proper results? Are you getting the results which are relevant to the topic what you have selected? In case if you feel that you are not getting proper results, which are not matching with the topic, in that case, we can refine our search strategy. We can try to add more components or maybe delete some components, and then we can go, because having a such strategy, it's not like a one step. We need to keep on modifying it until you finalize it. So once you finalize it, you can go for it in different databases and collect the information, collect the articles. So like that, you can see here in the second image, what you are having in the slide, the process is going to be like, the first one, we are going to have a topic. And from the topic, we are going to identify the keywords. And along with the keywords, we need to have the synonyms and all other things. And by having all these keywords and synonyms, we are going to perform the search in different databases. And we are going to see the results, what we are getting from the databases. And when you feel that it is not appropriate, the search strategy what you are having, we can go and refine it once again, add more keywords or delete some keywords, and come back once again for the search. And finally, we are going to have the evaluation of the results what we got it for conducting any systematic review and meta-analysis. The next slide, please. So the databases, as I mentioned, that we have now enough number of databases are available with us. The only thing is like issue access to these databases. As we know that PubMed and Google Scholar are the 2 important databases which are available freely. Freely in the sense, at least we can go and search these databases freely, no need to pay any money for that. Once you search, either you're going to get the full text article or not, that is depending upon the availability of full text article with your institution. But other databases where we need to have a subscription, like Embase, Cochrane Library, Scopus, EBSCO, Web of Science, these are the databases where we need to have a subscription. If you have a subscription, we can search within your institute, or most of the times what we are going to do while we are conducting systematic reviews, meta-analysis is like, we need to have a collaboration, because systematic reviews are the one which we cannot do alone or individually. We need to have a collaboration with the people who are having access to these databases, and also who are having good understanding on how to perform the systematic review and meta-analysis. Otherwise also, the minimum mandatory thing is for systematic review meta-analysis is like, we need to have minimum 2 people for conducting any systematic review. Unlike normal review, narrative review, even a single author can conduct the review. But a systematic review meta-analysis can be done only by minimum 2 people should be there. Because what are the steps we are going to have in systematic review? Literature search, and then screening of literature, primary screening, secondary screening, data extraction from the articles, and critical appraisal of each and every article. So all these steps, what we need to do is like we need to do that by 2 to 3 people simultaneously, independently. So when they do independently, because every person will be different and they can come out with the different findings. And if there are any differences, they can come together, discuss, and then finalize the things so that we can try to avoid the biases. So we need to avoid the biases here while performing the systematic review meta-analysis as much as possible. So that's the reason if more number of people are doing all this process independently, and if any discrepancies are there, if they come together and discuss, we can try to avoid a good number of manual biases. Okay, so that's what we are going to follow usually for conducting systematic review and meta-analysis. And out of all these databases, the very important one, which everyone should know, it is not only for conducting systematic review meta-analysis, being a graduate student, especially in a healthcare disciplines, pharmacy or maybe MBBS or maybe nursing, anyone who are in the healthcare discipline, they must be knowing how to search a good literature, especially from PubMed. So PubMed is very, very important, the basic thing which everyone should know, especially the pharmacy students, BPharm or PharmD students, MPharm students. You should be knowing at least how to search in PubMed, because PubMed is a day-to-day access. We're going to have it, and we must search a literature in PubMed for getting a primary literature. Primary means, as you know, that we can segregate the literature mainly into 3 types: primary, secondary, and tertiary. The primary means the original research articles. Mainly, we are going to get it from the PubMed. It's very well updated, and I can show you like how much amount of data already existing in the PubMed and why it is important. So next slide, please. So searching in PubMed, as we know that PubMed is a free resource where we can go and search for the literature, and it's a peer-reviewed one. And we are going to have a peer-reviewed biomedical as well as the life science literature. It is freely available. We can go and search. Anyone in the world can go and search freely the PubMed. And if you can see in the PubMed database, when you go into the PubMed, you can see that that database PubMed contains now currently more than 38 million citations. So those many articles are currently available in PubMed, and it's going to be increased every day, because in PubMed there are more than 3,000 journals which are indexed. Whenever any journal publish any article, that will be automatically indexed in the PubMed. So PubMed is a very good resource to search multiple journals at a time, single time, based on the topic what you are having. And we are going to have mainly the abstracts and other information about the articles in PubMed. And it was available for the public online from 1996 onwards. And it is mainly maintained by NCPI. It's important to understand for all the students. You should know like from where the PubMed is coming. The PubMed is mainly coming from the USA. It is especially maintaining by NCPI. That's called National Center for Biotechnology Information. That is there at the NLM. That's a US National Library of Medicine. And that is located and mainly coming under the National Institute of Health, NIH. So NIH is funding, and that is there under the NLM, which is mainly maintaining by the NCPI. So that's a basic understanding about PubMed. And many people will confuse between PubMed and Medline. It's very easy understanding. So Medline is a major component of PubMed. All the articles, whatever we are having, whatever we are searching in PubMed, we are searching indirectly through the Medline. So Medline is the one which contains all the articles, the review articles, research articles, editorials, whatever published by the journals will be available for us through Medline. The PubMed is going to be like a searching strategy. It is going to be like a searching platform. And once you search in PubMed, that means it is indirectly going to the Medline and giving us the articles. Okay. So apart from Medline, the PubMed is having access to different other sources, different other databases. But PubMed is one of the major component of the, Medline is one of the major component of the PubMed. Okay. So that's what is our understanding. Both are not different. PubMed and Medline are not different. Medline is a major component of the PubMed basically. And apart from that, nowadays we are having something called PubMed Central. It's called PMC, where all the free articles, like the articles which we can download freely, the full text article, all those free articles will be available from the PubMed Central. So when you go to the PubMed, when you see any article, if you want to get the full text article, if it is available freely, you can get a link. In the right side, you can get a link for the PubMed Central. And when you go to the PubMed Central, you can download that article in PDF format freely. So whenever it is available freely for us, we can download through the PubMed Central. Next slide, please. So when you're going to search in PubMed, this is like whatever you can see in the picture. That's a common search strategy, the common search box. If you have only one single keyword or maybe two keywords, we can go and generally search in normal search box. That is enough for us. But if you want to conduct any systematic review, if you want to do the search in a systematic way, we must be knowing all these things in PubMed. It is not a simple search will box for systematic review. We need to search in PubMed by using all these techniques, and you must be knowing all of them. Like we are going to have an advanced search. We are going to use main important thing is a mesh. Mesh is a very, very important one. Anyone knows here in the audience what's the full form of mesh? Can anyone tell me? I would like to hear from you. Any audience, like what's the full form of mesh? MESH, a very, very important one, especially in PubMed. When you're searching in PubMed for systematic reviews, using mesh is very important. Anyone knows about it?
Medical subject headings.
Exactly. So it's a medical subject headings. So medical subject headings are very important in PubMed. Like whenever PubMed is indexing any article, they're going to give the coding for that article by using some of the keywords. And those keywords are mainly coming from the mesh, medical subject headings. Okay. So when you're using any medical subject heading of any keyword, that means you are indirectly searching all the articles on that particular keyword by using mesh. I'll show you how exactly we need to search by using mesh. And another important thing for combining keywords, like when you have any research question with you and you have a multiple keywords with you, you want to search all the keywords. It is not that simply we are keeping the keywords in the search box and then we are searching. We need to combine all the keywords by using any one of the Boolean operator. That's very, very important thing. That means we are combining the keywords by using the Boolean operators. And there are three important Boolean operators. We can have and, or, not. I'll tell you what is the importance of all the three when we are searching literature. And then when we are searching in advanced search, so you can see in the picture, below the search box, we have something called advanced. Below the search box, you can have something called advanced. So that's what is very, very important. While when you're conducting any search for systematic reviews, we need to go to the advanced and we need to try to use all these parameters. We are going to have some field tags in the sense like whatever the keyword you're having, you're expecting that that keyword should be there in the title. That means it is a main important article for you for that keyword. In that case, we can keep something called field tag TI. Within square brackets, we can have TI. That means that keyword must be there in the title. TIAB, that keyword should be there either in the title or in the abstract minimum. And then we can also search for author. Like that, we have a multiple available. So you can use any field tag for getting the articles which is relevant for you. And then we can have a filters and limiters thing in PubMed. So when you search in PubMed, in the left side corner, I can show you like you can have a multiple filters. Just by filtering that, we can try to avoid many articles. We can get only the relevant articles. And other important things are like truncations and wildcards. We are going to use them truncations, wildcards when you are searching PubMed database. And sometimes we're going to use the double quotation marks. I'll tell you like truncation, when we are going to use a truncation briefly. The truncation is a star mark, right? So for example, you want to search for asthma, that asthma written in a different fashions in different articles. What we're going to do is like we're going to write ASTHM, and then we're going to use the star mark, asthma. So if an asthma is mentioned like asthma, asthmaticus, or maybe any other terms related to asthma, where the common letters are there, like ASTHMA, common letters are there. After that, it can be like any other letters. If you want to get all those articles where all the related terms mentioned, we're going to use the truncations, star mark, okay? After keeping the common words, common letters, we can keep the truncation so that you're going to get all the remaining keywords automatically. You don't need to type all of them, all the different synonyms for the asthma. You can get all of them just by keeping the truncation. I can show you how to do that. And then wildcards. The wildcards are the question marks. We're going to use a question mark wildcard when you have some keywords with the different spellings. Like we are having US spellings and then UK spellings, and no need to type both the things. If you feel that only one letter difference is there between both the spellings, in that one letter, we can keep the question mark so that it will be selected all the keywords. For example, you have a favor, FAVOUR, we can write or FA Vivo, or also we can write. So you can be added or it cannot be, right? So in the place of you can keep the question mark, so that you are going to get all the articles where FA Vivo or is there and also FA Vivo UR is there. Okay. So whenever you feel that for the same keyword, there are different spellings, and whatever that one letter you feel that it's a different, in that place you can keep the question mark wildcard, so that you are going to get all the articles with the different spellings of the same keyword. Okay. So that's an important thing, wildcard. And the other one important one is like a double quotation marks. I think sometimes you can see the double quotation marks. The double quotation marks we are going to keep whenever you have any keyword which is a combination of two different words. For example, you have a myocardial infarction, okay? And when you search normally in normal search box, if you search myocardial infarction, you're going to get all the articles where it is mentioned myocardial maybe separately, infraction separately. You're going to get all those articles. But when you keep the double quotation marks for the myocardial infarction, you write the myocardial infarction and keep the double quotes. So when you keep the double quotes, what will happen? You're going to get only the articles where the myocardial infarction written together. It is not like myocardial separately and then infarction separately, you're getting all the articles. You want both the words together in the article where you're getting. In that case, we're going to keep the double quotation marks. We're going to get articles where both the keywords are there together. We're going to have the double quotation marks. And then also we are going to have something called related article search, that we can have it for getting more articles from the PubMed. So that's a quick introduction about PubMed and what all the things we need to keep in mind while searching in PubMed, especially when you're conducting any systematic meta-analysis. It is not that we can go with a simple search strategy. We are going to have an advanced search strategy. And when you're performing such strategy, when you're developing such strategy, we need to keep in mind all these things, okay? The search techniques in PubMed. I think that's the last slide I'm having. Maybe then I can share my screen and then demonstrate to you. So this is what is like, as the topic is mentioned, like, the importance of literature search and evidence synthesis. If you can see here in the process of evidence synthesis, the evidence synthesis means developing the evidence from the existing literature. And that's what is very important when you're taking any healthcare decision making. In a systematic review meta-analysis, the important thing is going to be like searching literature, search for studies. So you're going to get all the studies and you're going to combine them and come out with a final information, final conclusion. So in that process, searching literature is very, very important one in the entire evidence synthesis process. For that reason, I kept this one here. The next slide. So this one is a definition of evidence-based medicine. I think some of you may be knowing already, especially informed pharmacy practice students and pharmacy students, you may be knowing already. Evidence-based medicine, one of the important subject, one of the important area where the people are working currently, the evidence-based medicine. These are the definitions given by Gordon Guyatt and his professor Dave Sackett in 1990s. It's a consensuous, explicit, and judicious use of current best evidence in making the decision about the care of individual patient. That means whenever you're taking any decision to treat the patient, it is not that simply we can go with our interpretation or maybe our experience. Certainly, we need to follow what is currently available, the evidence, and based on that, we can treat the patient. So if you treat the patient based on the current and latest information, the latest evidence, we can call it as a evidence-based medicine. That's an understanding. So for that evidence-based medicine, conducting systematic review meta-analysis is very important. For systematic review meta-analysis, doing a proper search strategy is very, very important. Okay, so these are all interlinked. If you want to have a good evidence with you, we need to perform a good search strategy. And these are the 5 steps basically involved in evidence-based medicine or evidence-based practice. These comes with a 4 A's, like ask, acquire, appraise, apply, and audit. So when you click next, I think in this one, mainly we are going to discuss today in today's webinar, how to acquire the literature. The second step we are going to discuss mainly here, how to acquire the literature from different databases. And for today's webinar, we can discuss mainly about the PubMed. So once you know PubMed, you can easily search other databases. Next slide, please. So that's a presentation, what I'm having. Maybe I can now take you for another 10 to 15 minutes. I can take you to the PubMed and I can show you how exactly we can search. If you have any such strategy with you. Can you please confirm you can able to see my screen?
Yes, sir. Your screen is visible.
Yes,
Yeah.
visible.
Thank you, sir. So you can see here, this is the slide I'm having. And this is the topic. Recently, we conducted one systematic review meta-analysis on this topic, like understanding the efficacy and safety of lusiogliflozin. Lusiogliflozin is a novel anti-diabetic medication. Comes under the class of SGLT2 inhibitor. It's a sodium glucose co-transporter 2 inhibitor, the new class of anti-diabetics we're having. So we want to understand overall safety and efficacy of this new medication when we are using for the type 2 diabetes mellitus. And for that reason, we conducted the systematic review and meta-analysis, right? So if you feel that the topic is a research question for you, and you want to search the literature existing, especially you want to get the randomized control trials conducted on lusiogliflozin for conducting systematic meta-analysis. As I told you, like from the research question, we are going to have a keywords, and that keywords we're going to have based on the P code format. Okay, so P code. So P is a population. So population, we have the people who are having the type 2 diabetes mellitus, and for the type 2 diabetes mellitus, we are having some keywords. Okay, these are the keywords we're going to use it commonly when we are searching literature for the population. And for the intervention, we have a lusiogliflozin, and for that we have these are the keywords we are going to use it commonly: lusiogliflozin, SGLT2 inhibitors, the full form sodium glucose co-transporter inhibitors, or Lucife. Lucife is a brand name for the lusiogliflozin. So like that, we need to identify some of the important keywords. What exactly maybe in articles it could have been mentioned. Okay, so we need to identify those keywords. And for comparison, it can be like a placebo or any other anti-diabetic medication. So these are the keywords we can have it like for comparison. And for outcomes, what are the outcomes you're expecting from this systematic review? We can list out all the outcomes. And for those outcomes, we can have some keywords. Okay, so we are going to have the keywords for the possible keywords for all the PICO format. And by using these keywords, we are going to search for the literature. Okay, and finally, you can keep the time frame. What time frame you are expecting the outcome, like short term, long term, if it is required, if it is mandatory. And otherwise, we can restrict our search strategy mainly for the RCTs, randomized control trials. If you want to conduct the systematic review only by using RCTs, we can keep the RCTs keywords also. Like we can type randomized control trial, RCT, clinical trial, control trial, something like that. So that we're going to get only the RCTs. We are not going to get any other articles. We're going to get only RCTs when we are searching the literature. So when you go to the PubMed, so this is the PubMed page, web page, where I mentioned that it is mainly maintained by the NIH. Under that, we have a National Library of Medicine, NLM, and under that, we have National Center for Biotechnology Information. Okay. So this one is a simple search strategy box. If you want to type only one keyword, this will be helpful for us. Just lusiogliflozin, type it, and then search. You're going to get all the articles where lusiogliflozin is mentioned. This one is a simple search strategy, simple one. Okay. So just I want to know the articles published on lusiogliflozin. I just type lusiogliflozin here, and I got all the articles where the lusiogliflozin is mentioned. You can see here I got 191 results, and I can see for each result I can see the title, authors, and this is the journal name where it is published, the date of publication, and then we can have the DOI number. It's a digital objective identifier. DOI is a digital objective identifier, and that means like how we are having Aadhaar card number for every person, like that every article will be having a DOI number. Okay, so with this number we can able to track down the article, and this article is not yet published in the hard copy. So that's the reason we cannot see any volume number, issue number, page numbers. We cannot see for this article. And whenever it is not published in the hard copy, it is available only in the online format currently. You can see something like online ahead of print. So whenever we can see like online ahead of print, the meaning is like it is not yet printed in a journal. It is available only in the web application, only in the website of the journal. It is available currently in the online format. So when we are going to get the online ahead of print. And one more important thing, we are going to have a PMID. That means whenever it is indexed in PubMed, so this journal articles are going to be indexed in PubMed. Whenever any new articles coming from any journal to the PubMed, that will be given with one PMID. PMID is a PubMed ID. We are going to have a PubMed ID. PubMed is going to give one ID for this article. So like that, every article is going to have one different PubMed ID. Okay, so it's an ID given by the PubMed. And then we can have a brief description here. And if you want to read it further, this article, we can simply click on this title. We can go inside the article and where you can find more information. Like you can have more details about the title, more number of authors. And if you can click expand here, you can see even the affiliations of all the authors, from where they are, each and every author based on the coding given. You can see from where they are and what exactly their profile. And we can see here PMID, DOI, and finally we can see some abstract. So abstract will be available in PubMed. Minimum, at least we can see the abstract. And based on that, we can decide that, is it a relevant article for us, for our topic? We can decide and then we can go further, okay? And then if you want to have a full text of article of this one, there's a link provided in the right side. So here is a full text link. If you can click on this one, full text link, it will directly take you to the website of that journal where you can get the full text article by paying money, because it is not freely available. The full text of this article is not freely available. I think it's a full access is, I think for this article, full access is available. So that's what we need to see. If it is available full access, if you click on the PDF, you can get the directly PDF. I think this is the full text article is available freely from the journal. In that case, if you click on this PDF option, you can able to download the PDF, the full text article of that particular article, if it is available freely. If it is not available freely, you need to pay the money and get the access to that, okay? So this is the full text article which you can download directly from website of the journal, which we have gone through from the PubMed, okay? So like that, you can have a link from PubMed to get the full text article. If it is available freely, you can get freely. Otherwise, you're not going to get free. You need to pay money for it. And then, for example, if you want to cite this article in your manuscript, we have an option here, cite. So you can simply copy and paste this entire information. You can go and keep under your references. Okay. So this is some of the important information. We can have it in the PubMed in a simple search. So like this, you can have a number of results. And when you click on here, the show more results, you're going to get more results. Usually only 10 citations will be there in the first page. And if you click on the show more, you're going to get more pages and you can get more results. So if you don't want to click every time show more results, there's a simple option here. The display options you can see here, the display option, click here and you can keep that you need at least 200 per page, 200 citations per page. You can mention that here so that you don't need to click every time show more results. At least 200 results will be appeared at one tab in one page. Okay, so you can get all the 200 articles in one page so that you can able to see them easily without clicking anything like show more results. In the left side, you can see these are the filters what I mentioned. For example, in the Lucio Flows, you want only where the free full text is available. Just click on that free full text. If you click on the free full text, out of 191 articles, you can get now 129 articles which are available freely. You know, like the Kamaljeet, can you please unmute? Yeah, thank you. So you can see here 129 articles were freely available. And because they are freely available, you can see one more thing here in a orange color. It's a free PMC article. That means free PMC means it's a PubMed Central. This article is available freely for the full text. If you click on any one of this article, you can get the link for both. You can go to the website of the journal to get the full text article. It is available freely, or you can go to the PubMed Central. So there are two options. You can go to the PubMed Central and also get the full text article. Okay, so you can go to the PubMed Central here. This is the PubMed Central page. Whenever any article available freely, the full text, it will take you to the PubMed Central, and there's an option for downloading PDF. If you click on the PDF, you can download the PDF of that article. Okay, so like that, we can get an access to full text article from the PubMed itself if it is available freely. Okay, so like that, you have a different filters here. For example, you want now to understand only the systematic reviews and meta-analysis. Click on this meta-analysis. Remove this free full text. Now you're going to get, out of this 191 articles, there are 16 systematic reviews meta-analysis published, and you're going to get all of them. Only systematic reviews meta-analysis, you are simply getting it. That means you don't need to go through all the 191 and try to understand what are the systematic reviews. just by clicking one filter here in the left side, you can get only the systematic reviews. I think one among them is like our articles, what we published, the same efficacy and safety of fluciclovir in patients with a type 2 diabetes mellitus, systematic meta-analysis, what we published in Endocrine Journal recently. So like this, you're going to get all the systematic meta-analysis directly just by clicking the filters. And whatever you can see here, those are not restricted filters. You can add more filters. So there's an option here, additional filters. You can click on that. You can get more filters here. And also if you click on this, like, yeah, additional filters, you are getting all these things, and you can use any one of them. And if you want more than this, like for example, articles in English and Spanish, if you want more articles, you can see all article language filters. So you're going to get more filters here. And whatever the filter you want to be appeared there, you can keep it there. For example, I can keep Hindi to be available in the filter. I can click on Hindi and keep apply. So I'm going to get even the Hindi option here, right? So now I'm having three options: English, Hindi, and Spanish. So when I click on Hindi, I did not get any article. That means all the 191 articles are not available in Hindi. They're available in English and other languages. So if you remove that, you're going to get only the English articles. Okay, on Hindi there are no articles. This is like a normal search, which everyone knows. Everyone can do that. But for a systematic review, what we need to do is like we need to do some advanced search. So you need to click on this advanced, or if you go to the PubMed page, I can show you from starting. So this is the PubMed page. You can go and land in PubMed page, and down to that you have this advanced. I think before going to advanced, I can show you something called mesh database. It's an important one in PubMed. So if you go down a little bit in PubMed page, you can see something called mesh database. So click on this mesh database. It will take you to the mesh database. It is mainly to understand that what are the keyword you are having. For that keyword, any mesh term is available or not in PubMed. Okay. For example, I can type diabetes mellitus. Okay. So diabetes mellitus is a keyword. For that keyword, I want to understand that what is the mesh term available in PubMed. You type diabetes mellitus, search. When you search any keyword in mesh database, it will give you the mesh results. So you can see that diabetes mellitus, it is available as such, as a mesh term. So if you want to take that mesh term to the search box, what we can do, simply we can click here in the box, diabetes mellitus. And here there's an option that add to search builder. Add to search builder. So it will add directly like this one, diabetes mellitus, this quotation marks, double quotation, and then mesh. Okay. In Spanish, like we're going to have the and then you can go and search in PubMed. So it will go and search in PubMed, diabetes mellitus by using mesh. So it will come directly here. Okay. So when you go and use mesh, medical subject heading for diabetes mellitus, that's a standard terminology in PubMed. We are going to use it. And you are having these many results, 552,000 articles you're going to have on the diabetes mellitus. That's a mesh we're going to have it, okay, for diabetes mellitus. So like that, for any keyword, we can go and search in mesh database, identify what is a mesh term for that keyword, and we can use it in the search strategy, okay. So now when you go to the advanced, this one is a advanced page where it will appear here like this. And now what we can do for the search strategy, what I'm having, first I'm going to search population. How I'm going to search population? What I can do, like the diabetes mellitus, I can search in different ways. So when you click here, initially it will be like all fields. And when you click on this one, I want to know like articles where at least only in title and abstract, the diabetes mellitus is mentioned. Okay. DIABETS, diabetes mellitus. It is mentioned, diabetes mellitus is mentioned at least in the title and abstract, because I know that I don't want any articles the diabetes mellitus is mentioned somewhere just like that in the article. Maybe someone mentioned in the discussion part diabetes mellitus a word. I don't want that article because they simply mention diabetes mellitus. but the research was not conducted on the diabetes mellitus. So I want only the articles where the research performed on the diabetes mellitus. So in that case, I'm going to keep only the title and abstract. So whenever diabetes mellitus is there in the title and abstract, we are confident that at least the research performed on diabetes mellitus certainly, right? So for that reason, we are keeping the title and abstract, diabetes mellitus, and you can add here. So when you add, it will come automatically in the query box, okay? So in the query box, you can see now diabetes mellitus added as a title and abstract, right? So sometimes people may write diabetes mellitus, sometimes people may write type 2 diabetes mellitus. They can write diabetes mellitus in different ways. So I'm going to type like another keyword which can be possible in the articles, type 2 diabetes mellitus. And I want once again any article published with the type 2 diabetes mellitus in the title and abstract. Also, I want it. And I'm going to add this keyword once again here in the query box. And for that reason, we need to add here like already we have one keyword here in the query box, and I'm going to add the second one. The second one, how you want to add it? You want to add by using and, or by using or by using not. So that's what we need to select. This is what is called as a Boolean operators, and or not. We need to select one. So, anyone tell me like what we are going to use it here? Now already I'm having the diabetes mellitus. I also want any articles mentioned like a type 2 diabetes mellitus. Which one is appropriate here? Add with the and or add with the or? Because both are synonyms. I want the article where any one is mentioned. I don't want like
Sir?
Yeah, please.
NIDDM.
No, it's okay. NIDDM we can mention. I'm just asking like now we are already having the diabetes mellitus here, and I'm going to add the second one, second keyword. So between these two keywords, what should be there as a Boolean operators? It should be and or it should be or. Which one is more appropriate? Because what I want is like, I don't want both the keywords to be mentioned in the article. I want any one is fine. Any one. Either diabetes mellitus or type 2 diabetes mellitus. So which one is more appropriate? Which one is more appropriate here? And or.
It should be or.
Exactly. So it should be like R because OR. So what will happen now when you do like this, in any title and abstract, it may be diabetes mellitus or it may be type 2 diabetes mellitus. I'm going to get any article. Okay. So simply you remember one thing. Whenever you are adding any synonyms, you keep R, OR. Okay. For the synonyms, you can keep R. For the different terms, you want both the terms to be mentioned in the article. There we are going to keep the and. Okay. So if you want both to be available in the article, we need to keep and. If you want that any one is fine to be available, we are going to keep R. So like that, we can add n number of terms. Like it can be mentioned like NIDDM, non-insulin dependent diabetes mellitus also can be mentioned. And once again, I can add NIDDM by keeping the R NIDDM, right? And also now I can select the mesh because I know that because diabetes mellitus can be mentioned in different fashions in any article. In that case, you don't know multiple keywords, multiple synonyms for that. The simple thing is going to be like simply select the mesh term, and keep now. We know that for diabetes, the mesh term is diabetes mellitus. Diabetes mellitus is a mesh term for the diabetes mellitus in the PubMed. So I'm just keeping mesh term here, mesh term, and then diabetes mellitus. And once again, I'm going to keep by keeping R. Okay, done. So like this, we can add any number. So it is our responsibility when you're conducting any systematic review, track down maximum possible keywords for that particular keyword. Like for example, now I want to search the population with the diabetes mellitus. I can type maximum possible keywords with the different spellings, with the different terminologies, and I can keep everything here in this query box, all of them. Okay. So once you feel that you have completed all the terms related to population first, now you can go and search. Click on search. That means first you are searching all the articles where diabetes is mentioned as a population, and you got this many articles. Okay. Now you can go back to advanced once again. When you go to the advanced, the important thing is like whatever you searched previously, it will be available in the history. So you can go to the history. It is available here. So we searched previously about diabetes and we got these many citations. Okay, it is available here. Now I can go and search for the keywords for my second strategy. So for my second strategy, it is a intervention. I want to now type for intervention terminologies. In that, first I want to take this lucioglyphlosine, because lucioglyphlosine is my intervention. I want all the articles where the lucioglyphlosine is mentioned, and that lucioglyphlosine I want to be mentioned at least title and abstract. I don't want everywhere it is mentioned in the article. Minimum title and abstract should be there. Lucioglyphlosine. I'm keeping title and abstract and then add it. Okay. Now for the lucioglyphlosine, it can be mentioned lucioglyphlosine, or it can be mentioned sometimes Lucifi, because Lucifi is a brand name. In some articles, they could have mentioned even as a Lucifi. So I can type even Lucifi. Now, once again, I'm going to add this one by using R. Okay. Why I'm using R? These are synonyms. I want any article where any one of the things mentioned, I can use R and keep it once again here. Okay. Query box. And like sometimes people may mention generally like SGLT2 inhibitor. They don't mention maybe single medication name. They could have done with a lucioglyphlosine, but they mention as SGLT2 inhibitor in the title, so title and abstract. And I want those articles also. Okay, because lucioglyphlosine comes under the SGLT2 inhibitors. I want those articles also. I can mention SGLT2 inhibitor, and once again add that by adding with a R, because these are all the synonyms. I'm going to keep R. Okay. And maybe we can write even the full form of SGLT2 inhibitor. SGLT2 inhibitors. So what we need to do is like, first of all, we need to create any document like this, like whatever I'm showing here, the slide. So first of all, we need to make a slide like this, or maybe Word document like this, and mention what are the possible keywords for each and every terminology here, like PICO. And those are all the things we can copy and paste in PubMed. It'll be easy for you if you have a document like that with all the keywords. You can easily copy and paste in the PubMed. You're going to get your such strategy. Okay. So now I'm adding the full name of SGLT2 inhibitor. And once again, I'm adding this with the R. Okay. Now imagine that you have all the related terms of lucioglyphlosine. You have now everything with you for the intervention terminologies, and go and click search. Now you're searching separate, because the separate searching is very important. It is not that we are going to add all the terms related to PICO at a time. We are going to search P separately, I separately, C separately, O separately, and then we are going to combine them. Okay, so like that separately we need to have a such strategy and then combine them. So these are all the articles available for the lucioglyphlosine, and you can see here like you have got all the appropriate articles where at least lucioglyphlosine, SGLT2 inhibitors mentioned in the title. In all the title, you can see the any one of those terms mentioned clearly, either in the title or in the abstract. So these are all very, very relevant articles we got on the lucioglyphlosine. Okay, so we got all these articles. Now what we need to do, I'm not showing here because of time constraint. I'm not showing you the comparison outcome terminologies. We are going to add even like the same way. We are going to add all the comparison terms if it is required, all the outcome terms if it is required, and then we are going to combine them. So now you can see like how we are going to combine them. I want the articles where at least listen this carefully. It's very important one to have a proper such strategy in PubMed. Now what I want is like, I want the articles where any one of the diabetes terms mentioned, and also any one of the lucioglyphlosine terms mentioned. Okay, so any one of these terms should be there, and also any one of these terms should be there. I want those articles. So what I need to do, I searched already separately for diabetes terms and separately for lucioglyphlosine terms. I already searched, and now I want the articles where any one of these things mentioned and also any one of these things mentioned. What I can do simply is like, because I'm already having the such strategy here for diabetes, you can see here 3 dots. Click on 3 dots, add query. Okay, now it will be added here automatically. So all the diabetes terms are added automatically here, right? Now we have other terms related to lysogliflozin, right? So what we need to do, we can click it here. And now we need to see that because already we are having one such strategy here. When we're adding the second one, we need to select that. You're going to add the second one by keeping what? By keeping and, by keeping or, by keeping not. So which one is appropriate here? And or not? Which one is appropriate? Because I want the articles where any one of the diabetes terms mentioned and also any one of the luciogliflozin term is mentioned. So which one is appropriate? So what I need to keep?
And is appropriate.
Add with and, add with or, add with a not. That's good. I think.
And.
Yeah, Nagasheshu. Yeah, thank you for that. So we can see that we can add with and. So now this is a such strategy it is developed. This is what is called as a such strategy we are going to develop. And this is what we need to give it when you're writing any manuscript. Okay. Now you can see that the such strategy what we're having, any one of the terms related to diabetes. Okay. And also I want any one of the terms related to luciogliflozin. So you can see here and in between in caps. Now if you can go and search, you're going to get a very, very relevant articles, 4,851 articles, we got it, which are having in the title and abstract or maybe in the mesh database, okay, where at least it is on the type 2 diabetes mellitus population and also used luciogliflozin or maybe any other SGLT2 inhibitors. Okay, you can see here, if you see any title, it is more relevant. It's severe metabolic acidosis related to simultaneous use of metformin and dapagliflozin. Dapagliflozin is one of the SGLT2 inhibitor you're getting here. Okay, if you don't want any other SGLT2 inhibitors, you want only luciogliflozin, then you can go only with the luciogliflozin also. It's up to you what exactly you want it. And based on that, you can select the keywords and you can go for the search. So like this, now you're getting all the articles wherever this luciogliflozin is mentioned and also type 2 diabetes mellitus is mentioned, you're going to get all those articles in PubMed. So this is a complete such strategy out of, I think, more than 500,000 articles we're having on diabetes. We have narrowed down to 4,851 articles where diabetes is mentioned and also the luciogliflozin is mentioned. Now, out of all these things, like you don't want all the articles here, you want only the articles where the study conducted by using the randomized control trial design, RCT, clinical trial. So by simply clicking on the RCT, you're getting this only 479 articles, very narrow down articles. Out of 4,000 now, we have only 479 articles, which are clearly the randomized control trials. So I don't need to go through all the 4,000 articles. I can go through simply this 479 articles and then try to see that what all the randomized control trials perform on luciogliflozin among the people who are having the type 2 diabetes mellitus. Very easy for me, right? So now I got only the specific articles, randomized control trials on the luciogliflozin among the people who are having the type 2 diabetes mellitus. Okay. So like this, you can develop your own such strategy based on the requirement, based on your question. We can even keep on adding the terms, synonyms, and develop the such strategy like this. So this is what is called as such strategy. Manually, we cannot do this one. You cannot simply make this a strategy simply like that without going to the advanced such strategy. So now you can see in the advanced one, whatever you did already previously, everything is available here. And this is what is a combined one. Simply by clicking here 479, you can go back to once again those 479 articles where only RCTs are available. You can see here what are the filters you applied. Anytime, if you don't want the filters to be applicable, you can clear all the filters. Clear all filters. You can come back to the original articles where you searched 4,851 articles. Okay. So this is I can say like, only 10 to 20% I explained to you the advanced search strategy. Still so much is there. I thought I can give you a brief idea about it, how to search in PubMed, what is the importance of doing it, and what is the importance of going for advanced search rather than the normal search, simple search. Because if you want to track down the best evidence, you need to know how to search in PubMed. You should be an expert in searching PubMed at least by using all these techniques. Okay. So now I think I can show you simply few other things I told you like myocardial infarction, right? When you just type myocardial infarction, just like that in a search box, you got this 307,182 articles, right? It is like wherever the myocardial is there and wherever the infraction is there, it is going to be take like that. But I want myocardial and infraction to be together. It is not that myocardial somewhere in the article separately and infraction separately. I want both the words together. I'm going to keep this double quotes here, right? When you go and search now with the double quotes, the same myocardial infraction, the numbers will be reduced. You can see now from 307 odd articles, 307,000 articles. Now we've got only 297,000 articles where myocardial and infraction mentioned together. Okay, so that's what is the importance of this quotation marks. We need to have the quotation marks whenever you want both the words to be appear together. And other thing like, for example, now I want any article where the children, child, childhood, all the related terms mentioned. If you cannot know, or if you cannot type all the keywords related to children's or child and all these things, you can simply keep whatever the common letters comes, keep those things, CHILD, and keep the truncation. So this is the truncation, CHILD, truncation, star mark. You can go and search. You're going to get all the articles where either children mentioned, childhood mentioned, any one of the terms where after the child, if anything is there, all those things are going to come here. Okay. You don't need to keep all the terms, like you can keep child here, you can keep children, you can have a childhood, all the related terms you're going to get automatically just by keeping the truncation. Now I don't want no the children, child mentioned everywhere in the article. So you can see now you have a huge number of articles. Okay. I don't want the child mentioned everywhere in the article, anywhere in the article. I want the child or children mentioned only in the title or maybe in the abstract also. TIAB. TI is only title and TIAB is an abstract. So if you want only the children, child mentioned only in the title and abstract, you can keep this TIAB and then you can click search. Now you can see the numbers are going to be reduced drastically. You can have a very less number now where the TIAB is mentioned, where the child is mentioned either in the title or in the abstract. Or now if you feel that even this one also very huge number, I don't want even an abstract, I want only in the title, just keep TI in square brackets after the keyword, and you're going to get the articles where the child, children, childhood mentioned only in the title. So you can see now you're going to get a very good relevant articles where the children, child mentioned, especially in the title. So in title, if it is there, means it is specially conducted on the children. We are going to get only those articles. You can see now everywhere you're going to get only the relevant articles. That with a less number, it will be easy for us to go through all these articles. Okay. So like this, we need to use all these such techniques. What are the such techniques I mentioned in the slide? So we can perform all of them here in PubMed, so that we are going to get the exact number of articles, because searching in PubMed is not that easy. As we know that more than 38 million articles are available. If you simply use the keywords like that, you're going to get a huge number of articles and it will be very difficult for you to identify the relevant articles. So for that reason, we need to have a proper search strategy with us, with the proper keywords. Go and search with the keywords properly, and you're going to get very, very relevant articles. When you're having relevant articles, the output, like systematic meta-analysis, what you're conducting is going to be more relevant, and you're going to get more precise results. Okay. Otherwise, it's going to be very difficult. We cannot able to conduct any systematic meta-analysis without knowing how to search in PubMed with a advanced search strategy. And so this is what is from my end for this 1 hour of webinar. And further, if you want to know in PubMed, if you can go and type in Google, you can have a PubMed tutorials are available. PubMed tutorials, these are made by PubMed only. The PubMed online training you can have. You can go and watch all these videos and practice it. Without practicing, you don't get anything. You need to practice it. So there are so much of information available from this PubMed online training. Whatever I explained, they will explain even much better with a much information. You can go through further, watch all these videos, and try to understand how we are going to search in PubMed. These are all the things you can know. Everything, every information with the video lectures, it is available here. If you're interested, if you want to work further in the evidence-based medicine or maybe in the systematic meta-analysis, understanding PubMed search is very, very important. Okay, so you can go through this one and you can get, you can learn maximum possible, and also you can have so many YouTube videos are available already on PubMed. Even some of my lectures are available on PubMed search in the YouTube. You can search for them and you can go through that information. You can get more idea. Okay, so here I would like to stop giving this information. What is the importance of doing PubMed search? That too by using the strategy which developed properly. I think this may be like a no, just for introduction for you. What is the importance of PubMed and know how to search in PubMed? But further, so much is there. I think we can conduct easily 2-3 days workshop only on PubMed search. That much information already there. Further, it's up to you. Like now, you can go and develop your skills how to search in PubMed. So thank you very much for your patient listening. And if you have any queries, maybe we can discuss further.
Yeah, thank you, Dr. Krishna. It was a wonderful webinar, and I have been noticing that this is the most pain point for all the researchers to develop a comprehensive search strategy. That's where most of the researchers lack, and this was such an important topic, and you explained so thoroughly. We really big thank you to you. And
Thank
if
you.
over to audience, if you have any more questions, you can ask. Otherwise, we would like to close the webinar.
Thank you, madam. So it's not only for the, like you may be thinking that no, literature search is important only for systematic review meta-analysis. It is not only for systematic review meta-analysis, for any research. For any research, understanding literature search, the review of literature is very, very important. What will happen many times that no, we may be getting some idea into our mind and we will jump and work on it. And later we realize that no, so much work already done on the topic. There's no need in conducting once again, right? So that's the reason whenever you have any topic in mind, the first thing we need to spend time, at least minimum 1 month time easily is like on the literature. Understand what is existing first, either in India or maybe in the global on that particular topic, how much information already available. If you go through the literature completely, you can understand that what is available and what you can do further. So that whatever the work you're doing in research, that can be like an added value to the existing literature. It is not like a same redundancy, the same thing you are producing once again. You can produce something which is new to the literature, and that can be more value to the like audience and the literature.
Exactly. It's very important to do the literature search. It's like sometimes we waste so much of time and we later on realize that, oh, it was already there existing.
Exactly.
So it's very, very important to do a comprehensive literature search, literature review. So thank you. Thank you, Professor Krishna. And Ariman, do we have any questions in the chat box?
No, ma'am.
Okay, so can we tell everybody to unmute or unblock their cameras so that we can have
So
a
excellent
group
talk, Dr.
photograph?
Krishna. Excellent talk.
Thank
Thank
you.
you for delivering.
Thank you very much. Yeah.
So, yeah, can you please unblock your cameras so that we can have a group photograph for this webinar?
I have a question.
Yes, please.
Oh, we have a question. Yeah.
Yeah, I have already posted in the group, in the chat box. But the question is not that much a very lengthy question. Is about the pet mode search. So I saw on that existing beside the advanced search, there is what they call like create alert and create an RSS. So I want more brief information about it, like more explanation about it. So
Yeah, sure. Thank you for that. I think because of lack of time, I did not mention all those things in PubMed. Like when you go to the PubMed, we can have our own account first. We can create our own account with our email ID, and you can keep an alert. For example, now I'm interested in lusocyclofloxacin. I can keep the alert for lusocyclofloxacin. Whenever any article published on lusocyclofloxacin, I don't need to go to PubMed and search. I'm going to get my email communication directly that this is an article published and it's available now in the PubMed. You can go and check for that article. So that like that, we're going to get the alerts every time. And the RSS is once again the same strategy. Like we're going to have more related terms. We can use it. and which are very nearby terms, where we are not going to miss any articles, even though they are apart. Like, the myocardial is here and the infarction is there after 2-3 words after that. And we are not going to miss even those articles when you keep the RSS. So I think you can get even more detailed information in the PubMed tutorial, what I've shown you. If you go through that one by one, and also practice it. Like, you can have a strategy with you, practice it, so that you're going to get more idea into it.
Thank you, sir.
Over to you, Ariman. We can just move towards the closure of the webinar.
Okay, ma'am. Since there are no further questions, I would like to thank all participants who have taken out their time to be a part of this wonderful webinar. Thank you, Dr. Krishna, on the wonderful talk. It is one thing to, talk about the theory, and then one thing to demonstrate that with an example, so that, this is like a stepping stone for anyone who is interested to carry out systematic review or meta-analysis. So thank you so much for all the audience. This session has been recorded, and if you want the recording of the session, we'll be sending it to you via email. And also it will be available on our YouTube channel in a few days. So you can rewatch it, relearn it, and continue, exploring your interests in evidence-based medicine and systematic review and meta-analysis. Thank you so much, everyone, for your time. It was a wonderful webinar. Hope to see you again in the next webinar series, which we'll be having on in the next month. Thank you so much.
Thank you, everyone, for this wonderful feedback. And thank you for having me, and have a good learning experience later on. Thank you.
Thank you, sir. Thank you.
Thank you, sir. Thank you, everyone. Bye.